When and how do you manage estrogen levels on patients that are on testosterone replacement? Well, when, in my opinion, and there's a lot of opinions about this, when is when a patient's experiencing side effects. I don't like to start managing estrogen levels in patients when they have no side effects and they feel great at a certain level, regardless of what that level is. Some guys can tolerate a lot more estrogen than others. They're built for speed when it comes to certain hormones. Why start limiting that if they have no problem? So that's the when. And the how, there's two ways to do it. One, you can stop the body from producing the actual estrogen. The body uses an enzyme called aromatase. It grabs testosterone, turns it into estrogen. Then those estrogen molecules go find estrogen receptors. They sit on those receptors and they do estrogenic activity. So if we limit the conversion of testosterone through that aromatase function into estrogen, that's one way to reduce it. We do that with a drug called anastrozole. Anastrozole gets a mixed bag, if you will, or sometimes a bad rap. Some people love it. But on the internet, a lot of people don't understand it. So they say, hey, you should never ever use it and this and that. That's not true. If a guy's estrogen levels are too high and he's having side effects, you need to bring that down. The anastrozole gets a really bad rap because it works so well. And doctors overprescribe it in two ways. They give guys way too much of it, which drives their estrogen levels down to nothing, and that causes a problem. Or a guy's in a really good spot, he feels great, and the doctor gives him anastrozole just because he wants the number lower, and then the guy doesn't feel well. And both of those are the wrong time and the wrong way to use it. So we only use it for guys that have their estrogenic symptoms or we feel like they might, and then we tell them to use it as needed, and we figure out if they do need it or not. And if they don't need it, we don't give it to them. The other way to do it is you can block the actual receptors. So the body can make as much estrogen as it wants, but if we block the receptors, it can't sit on those receptors and do estrogenic things, which can cause problems. Again, if there's too much, is what I'm trying to say. But the problem is those tissues, they have estrogen receptors for a reason. They need estrogen. So we don't want to block that. We make an exception in the case of Clomid for active family planning sessions, and again, that's short term. And we use enclomiphene, which sort of does that, but it does it in very small windows and only a couple times a week, and that's to keep testicular tissue stimulated. So again, guys, when a guy has symptoms of having excess estrogen, he's having side effects from way too much estrogen, and how we typically like to block it using as little anastrozole as possible just to get rid of the side effects and get the guy at the right level for him. This is incredibly individualized to the individual patient. Once you get good at that as a practitioner, this really starts to eliminate all the side effects from having too much, and we also don't drive guys into having side effects and health concerns of having too little estrogen. Hope this helps, guys. Y'all have a great day.